Today we're talking about flu medications and how some of them can actually cause a positive drug test result.
Interesting. That's a surprising twist, right? How do these medications trigger such results even when they're prescribed?
Well, for instance, codeine, commonly found in Tylenol 3, gets metabolized into morphine, which can show up in your system as a positive test for opiates.
Yeah, exactly. So it's not just about illicit use, but also about legitimate prescriptions that could muddy the waters?
Absolutely. And then there's hydrocodone, which is used both for pain relief and as a cough suppressant. It's in medications like Norco, Lortab, and others. If you're taking it as prescribed, it can also result in a positive test.
Got that. And what about over-the-counter options? I've often heard that some cold and flu remedies might trigger false alarms too.
Many people think that sympathomimetics, such as pseudoephedrine, ephedrine, or phenylephrine, might cause a positive test.
Right. But as I understand it, these decongestants may cause an initial non-negative screen, while the confirmatory tests clear them, right?
Exactly. The initial screening might pick up a signal, but the follow-up GC/MS test confirms that they're not genuinely positive for controlled substances.
That initial flag could still lead to some unnecessary worry though, couldn't it?
Yeah, it could. That's why it's super important to keep a copy of your prescription handy so you can explain the situation to your medical review officer if needed.
Makes sense. So both employees and employers really need to be aware of these nuances in medication effects on drug tests, right?
Yep, staying informed is key. It helps ensure that if a test comes back positive due to something like codeine or hydrocodone, there's a clear record that it was all by prescription.
Right, exactly. I do have a small critique though. If these medications are so common, don't you think there should be quicker, more foolproof methods in drug testing to differentiate between prescribed use and substance abuse?
That's a fair point. While the test procedures, like the GC/MS confirmation, do help distinguish genuine positives, perhaps more streamlined processes or even better communication protocols between drug testing agencies and healthcare providers would further reduce these concerns.
Yeah, I totally get that. It's almost like they need a sort of prescription badge in the testing process, right?
Exactly, it's like having documented proof of legitimate use. That way, there's less risk of punitive action when you're just managing your health.
Very true. And in today's busy work environment, both employers and employees benefit from that clarity.
For sure. It builds trust and makes sure that everyone, from HR to the doctor, is on the same page about what's expected during drug tests.
Right, absolutely.